Hey guys, so we have a special guest today. Some of you may have seen Bethany's video. Bethany had a deep neck lift, chin implant, buccal fat reduction, rhinoplasty. What's up, Rocky? Um, we did that for her on Friday, and then I saw her for her morning checkup on Saturday, and she was nice enough to allow me to share her story. And so she was the subject of my video today. Well, that was day one, was yesterday. Day two is today. And nurse, originally from New Jersey, but has been a travel nurse for a while. And she is actually going to join me here in just a second. There she is.
Hey,
How are you?
I'm good. I look so swollen.
Well, that's exactly what I want people to see is how swollen you are and kind of what it is to be like on the second day after this kind of surgery.
Yeah, I feel so much better today though. I mean, I was out and about, going into stores again, living my normal life. I retired the robe to feel a little bit more normal. It feels good.
So, for those people who don't know what you're talking about, so first, I kind of introduced you. You're Bethany. Do you go by Beth or
Yeah,
Bethany?
Bethany, that's okay.
Bethany, yeah. And so she came in on Thursday. We did her surgery on Friday, and
Yeah.
then Saturday was the first day checkup. We posted her video, and then today is the second day after surgery. Someone says supermarket girl. What do you think she means by supermarket girl?
That's so funny. Yeah, someone saw me in the grocery store, took a picture, and sent it right to you. I thought it was great. For a second, I felt like a celebrity.
So I have eyes all over St. Louis, and it's actually one of my wife's good friends that noticed. So we give all of our patients, we give a bunch of stuff actually. One of the things we give them is a robe instead of having them in a hospital gown on the way out the door. They're in a nice kind of fluffy, uh, what would you call? I don't know what you call that material.
I don't know. Just, I'm not sure.
Fluffy, yeah, velour or something like
Yeah,
that.
really soft, very warm. Yeah, it was very nice.
Anyway, so someone recognized that her in that robe. So she had her drains all clipped to her robe. She's out there shopping. Someone said, "What is she can do with all that water?" Did you buy a bunch
Yeah,
of water, or they just buy?
well, yeah, just because we live in the Airbnb, we just wanted
Yeah.
bottled water. That's it.
So, who did you come with? I know the answer to this, but people are going to want to know. They're curious about what it's like to travel in for this kind of thing. Who did you come with?
I came with my sister. We came separately. I drove from LA and came in. I'm kind of all over the place right now. I'm a travel nurse, but I'm gonna settle in LA. I'm done traveling. I've done it for 2 years. And she came from New Jersey. She flew in. So we came from two
Okay,
different ends of the US. Yep.
quite literally met in the middle.
Yep. Yep.
That's awesome. And so, you came in, and why here? Why did you land in St. Louis? Out of all, leave LA for plastic surgery and come to St. Louis.
Everybody asked me that. They're like, you're in California right now, because I was just working in San Fran for an 8-week contract. And they're like, why are you going to Missouri? What's in Missouri? Why would you go there for plastic surgery when you're in California? But the thing is, I've been looking for a surgeon for at least a decade, if not longer, specifically for this surgery. And it's not so easy finding a surgeon that you can trust to work on your face. So I
So,
and about there before and aftercare, and I loved it. I loved how you interacted with your patients and how you treated them. It was very different from any other doctor that I've seen before, so it was a really easy decision for me.
so what was your process like? You sent in photos. I'm sure we made you send in photos first.
Yeah, and they were free, so all I did was send in photos, and then you made a suggestion of what you think, or I made a suggestion of what I want, and then you make a suggestion on how you feel, if you would want to work on me or not, if you feel that you think that there's anything that needs to be done. And that was it. Like, you don't ask for any money or anything. And then you go from that, however I wanted to go. Do what I want to pursue or not. So then I signed up for a consult, and everybody was great. Whitney, I was with Whitney, and she's been working with you for what, 10 years? But she just
About.
made me so comfortable. It was so easy. And then you were very personable. The whole process was just amazing. And it was very different from, I've had other consults before and I wasn't going through with it. So it was a real easy decision for me to just go with it, go with the surgery. I wasn't scared at all.
So now that's awesome to hear. So we did our consultation, and then you had a pre-op phone call. Probably either Gina or Julie did your pre-op phone call a couple weeks ahead of the surgery.
Yep.
And do you
Yep.
remember what they talked with you about on your pre-op phone call?
Wow, a lot. They went into really good detail. I mean, it was very necessary. They weren't skipping any steps. They went into what the aftercare would be for the rhinoplasty, for the neck lift, and for the chin implant. And a lot of it all lift, um, laying flat without the pillow and stuff like that. But they went over everything over and over and over. It was very repetitive, but it was very necessary for me to feel very comfortable and confident in what was going to happen, what procedures were going to happen, and we were all on the same page. And even when I came for the surgery, everybody asked me over and over again individually, what are you having done today? Like there was no confusion of what am I getting done. Very comforting.
Yeah, I think we're having a little gap there. I apologize. So we ask, so she had her pre-op visit, then we meet you the day before surgery, and we do what we call meet and greet. We discuss it all again, one extra time. And just in case there are any little last minute changes or that kind of thing. My cat's all over me here. And then after that, on the day of surgery, even the morning of surgery, we ask you one more time, okay, what exactly are we doing for you today? And I name it all, describe it all. So when we actually go into the operating room, there's no surprises. And by the time people get there for surgery, people usually feel very, almost weirdly relaxed. Like they're nervous, but they kind of got it. Do you kind of feel like that?
Yeah. Yeah, I was very relaxed. I mean, like as in the IV and stuff, I started getting just a little bit nervous, just because I know my veins can be difficult to get sometimes for whatever reason. But everybody was super comforting. And then you have one, so sorry, I don't remember her name, but she also had a deep neck lift and she was there. So it was like super comforting knowing that like 40% of your staff have had surgery from you. I think that really speaks volume in itself that if your staff, you're a great doctor, your staff is getting work done from you. So it
So
was
that
really
was
to have her in the OR.
that was actually Joni. She is my scrub tech on the vast majority of my cases. And her picture's actually on my story today. She posted a little something about her swelling at 3 months and that kind of stuff. So that's Joni. She's amazing.
She was so comforting. All of them were. Yeah.
So what was your anesthesia process like? So you remember getting your IV started?
I do. I was super grateful for her because she told me that she gauges each patient differently on how she feels that she should approach it. She put the IV in and started giving me the medication to make me sleep, and I'm so grateful that she didn't tell me right away. She might tell you, she might not. But off of my case, because I looked at her and I said, I'm scared at the very last minute. She did it calmly. It was so peacefully. And I said, I'm getting tired. So I turned and looked at her and I was like, thank you so much for not telling me you were about to push it. It was just such a peaceful process. They put really warm blankets on me. They made me feel so comfortable. Everybody was just, I mean, I can't really say enough about it. It was just a great experience. And
So
it's
that particular nurse anesthetist that you has also does a lot of pediatric patients. And it's very interesting. With some people, it calms them down the more you tell them every little layer of detail makes them feel more calm. But
yeah,
then with children and then with people in certain circumstances, like if you start telling them more, they actually start getting wound up. It's like the other direction.
yeah,
You know what I mean?
I'm
And
that
so, yeah. And so she kind of read that in you and said, okay, we need to make sure you know what you need to know, but more than that is actually counterproductive. So different people are different.
exactly. She gave you really, she was on point.
Good. So how are you feeling now? So first off, we had a couple of people have asked about the drains. Do you still have your drains in?
I do. I still have them. Where are they? They're around here. I have
Yeah.
two. I don't know
And
if you
if
can.
guys, if you, oh, there you go. I'd say if you go back on my story today, you can see where they came out from. They're hidden behind her earlobes.
Yeah.
And everything, all the purple on her is actually marker. There's maybe a little bit of bruising under her eyes, but the neck, all that purple that you see is actually surgical marking pen. She's actually not bruised down there at all.
No, it looks
Crazy.
really. Yeah,
Yeah.
and my not normally this square. That's literally just how much swelling it is. And is it today and tomorrow that are the peak of the swelling?
I'd say maybe tomorrow and today after. I say around
Yeah.
72 hours post-op. So we're 48 hours now, and then tomorrow will be 72 hours. I think it's kind of the peak. And so the reason you're so jolly right now is I did 4 different operations that create swelling in this place, right? So rhinoplasty swell, they start in the under eye and they travel down to the jowl. Buccal fat reduction swells down here, 5 actually. Fat transfer to the top of the cheek swells down here. That's number 3. Chin implants swell over here, and neck lifts swell over
Yeah.
here. So you had 5 separate procedures, all of which create swelling right in this one spot. So that's why you just look so Marlon Brando kind of Godfather at this moment. But that's
Yeah.
okay.
Yeah.
Um,
And the OR picture that you sent was
yeah,
phenomenal. You could clearly
yeah.
see that there.
So sneak preview on that. So you're going to see a really nice change on your profile and side view, front view. Profiles, the side view comes in very early. You'll see an improvement of that like now, and then when we take your splint off, you'll see a really nice improvement on your profile right away. Front view takes a little bit longer. It'll take you another couple weeks to really appreciate that.
Yeah.
So a couple questions coming through. Wait, she had a neck lift? Yeah, she had a
Yeah.
true deep neck lift. Where did we take the fat from the fat transfer? Do you remember where I got the fat for your fat transfer?
Yeah. So there's an incision. You did the incision. You put the chin implant. I don't know what first, and then you took fat out. You did the deep neck lift, and then you recycled some of the fat cells, subcutaneous cells. And then if you look right here, it looks like there's 2 little. Is that where you went in and
Mm-hmm.
you put
Yeah.
the cheekbone area?
Yeah, that's exactly right. So she has one incision that's in the crease behind her chin. Those heal to nothing. You can see it pretty well right now because it's got marker on it and stitches on it. When they heal to nothing. From there, the first thing I did, you're exactly right, is I placed her chin implant first. It's the cleanest part of the case. So from that incision went forward, placed the chin implant. I then did the entire deep neck lift, which involves the deep structure here because based on the way you were structured, even when you're younger, the neck you're going to have now is going to be better than the neck you had when you're 20.
Yeah.
So I did that deep neck lift sculpture, including the gland work to be able to create shadows along the side, all the way up the side of the jawline. Some of that fat was then recycled and put into the high outer cheek. So my goal is to bring this part of your cheek in
And
and
that's what.
highlight that part. Yep,
Yeah.
that's the buccal fat reduction, right? So I'll show you all my anatomy here. The buccal fat is here. That's where buccal fat reduction comes into play. Glands are here. So this part is deep neck. This part is deep neck. Building this out is chin. That's buccal fat reduction. And then accentuating the high outer cheek will help create that transition. And it's going to be it turned out super, super pretty. So let's see. Someone else, another question. Wait, she had a neck lift? Yes, she did. Does she remember anything from the surgery? Do you remember anything during the surgery?
No, I definitely don't. I do remember a little bit waking up. Had nothing to do with the surgery, though. I do not remember any bit of the surgery. Literally, the second that they put the IV in and they started giving me the sedation medication, I was out like a light in like 2 seconds. It didn't take long. I knocked right out. And when I woke up, I just remember, I don't know how long it was. I don't know what I remember, what I don't, but I just remember them like helping me get my clothes back on and stuff like that. And I was like waking up. I don't remember how I got in the wheelchair. I'm not sure if I remember how I got in the car. So I remember bits and pieces, but not much. And I'm grateful for that.
Good. Well, so we use a brain monitor during the surgery. We use it's more than just regular monitored anesthesia care. We're also monitoring your brain waves. So yes, we're monitoring your vitals and your pulse and your blood pressure and watching responsiveness and everything, but we're also watching the electricity in your brain, the actual waveforms, which give us a really tight sense of one additional data point to monitor. And so what you describe is super common. You're actually no recollection, but we don't have to over medicate you either. The portion between finishing surgery and kind of going home for the evening is often kind of fuzzy just because you're still kind of getting over the anesthetic. But by later on, first evening, were you more clear that evening?
Yeah, I was. I just slept though. I slept for, I mean, I slept all day, all night, and I woke up. It was great. I would wake
So,
up, take my medications. I did have that protein drink that they told me to drink for dinner.
oh
So
yeah,
I did. Huh?
let's talk about food. The food has been something that you mentioned a couple times. Talk about
Well,
that.
I think nutrition is so important of healing. You know, I work in the healthcare field too. I'm not in the cosmetic, you know, I'm a bedside nurse, but nutrition is such an important part of healing. And I remember, you know, on how many times I've looked at multiple surgeons and I've had consults with other people before. I've never heard of a doctor providing meals for a patient after surgery. I'm not sure if that was common or not, but I've never seen that. And not only that, they're so high in protein. And how you explained it, like it's always nice to know why we're doing what we're doing. How you want the low salt and everything, less flavor, but it's still really healthy to not build up fluid because of what we did with my face. So we have drains and stuff, right? We don't want fluid building up. But I could even grab one of the meals. I mean, they're just so good.
Yeah,
But
why don't you grab one? Why don't you grab one?
yeah,
Go ahead and grab one. So this was actually my nurse, Julie Rhodes. She's my operating room director. She's been with me since 2007. Um, she actually came up with this idea. So no, it is not common for surgeons to feed their patients for the first few days after surgery. As far as I know, we're the only ones that do it. So Julie said,
yeah,
instead of telling them, eat this, don't eat that, why don't we just feed them? So yeah, let's take a look there. So this company that we use is the local St. Louis company called Fit Flavors. And so those
yep,
pancakes have what, 22 grams of protein in them.
yeah,
Um, they're very nutrient dense, and they're one of the different options that we give people after surgery. And that way, you know, you came in from LA last week, got a patient, another one from California, another one from London, another one from Denmark. It's even our local patients, like it's just nice not to have to figure it all out. May as well have everything there for you. So those are freshly prepared, they're not frozen,
yeah.
they're not preserved, they're actual, real, high nutrition food. And actually, so on the day of surgery, we give a big box full of the appropriate things to our patient's caregiver or the nurse if they're using a nursing service to take home with them. And then for the first night or two, we just give you these high protein shakes because most people aren't really in the mood for a full meal the evening of surgery.
Yeah. No, I thought it was fantastic. Just to get the burden off of your shoulders of what you need to eat. You know, I'm sure so many people go for fast food or something like that after surgery. They don't want to drive. They can probably do like Uber Eats, and that's really not what you should have after surgery. I mean, I'm not a surgeon. I'm not telling people what they should have or not. For me, like I'd rather have that. You know, salmon, high protein pancakes. It tastes really good. It's not high in flavor, but it's still really good. Like it's really good food. It's nutritional, and it's just going to help the healing process. I've never seen that before, and I just thought that was great.
So again, it's my nurse Julie Rhodes' idea. She came up with that, and I think it's genius. So a couple people asked how long your surgery took. Do you know how long your surgery took?
It took 6 hours. Well, the estimate was six. Was it six?
So you entered the operating room at 8 o'clock. Cut time
Yeah.
was about 9 o'clock. It takes almost an hour to get you positioned, get everything sterilized, prepped, draped, to get the numbing medicine injected, all that kind of stuff. So my actual surgical start, it was probably shortly before 9 was actual surgical start. Let's call it 8:45. Um, Surgery finished. I was putting dressings on at 1:15. So that means actual surgical time about 4.5 hours, total time in the operating room about 5.5 hours, which is kind of what we expect. So when we say
Yeah.
6 hours, that's kind of total time. So I was putting dressings on at 1:15, you're probably rolling out about 1:30. So
Yeah.
actual time in the operating room was very close to 6 hours. And that's just
Yeah.
about right. And someone is here saying, I thought I understood that a patient stays 10 days post-op. Now all this stuff, by the way, the special diet, the 10-day stay, this all relates to neck lifting. If we had done her nose alone, this would be a lot more loosey-goosey. But when
Yeah.
we get a neck involved, we get real serious with it. So she says she thought the person has to stay 10 days post-op. Is that incorrect? Are you
I
staying 10
know
days?
I know I have to
Yeah.
stay 10 days. Yes.
Yes. So she is actually in St. Louis. She's at her Airbnb right now. And we just thought this would be a fun way to do an extra little checkup and also educate people at the same time. So she is still
Yeah.
here. So anyway, so you got home, you felt pain. A couple people have asked for pain. No, they haven't asked for pain. They've asked about pain. So describe your pain course, what you've been taking, how you've been feeling, where you've been feeling it, where you haven't been feeling it, that kind of stuff.
Yeah, so I've been taking Q4-hour Tylenol. Now I'm down to every 6 hours instead. That just started a little bit ago, every 6 hours now. I did take half of a hydrocodone, I think it was that we have. I forget
Hydromorphone,
which. I'm so sorry.
hydromorphone. It's okay.
Thank you. One medication. So I've taken 2 halves of those at different times, and then the Tylenol. I'm not in a whole lot of pain. It's not unbearable. It's just throbbing, and it's just like the swelling. You just feel the best way that I can describe it, which is kind of odd. I don't know if you've ever had braces. I had braces, and when they would tighten them and everything, and they would have that pain all in your face. That's what it like for me. It feels similar to that.
So let me ask you a question. So if like right now in this conversation and you're kind of trying to think and remember and ask questions, is it so much that you're still acutely aware of it through all that? Or like when you're in the middle of thinking about things, doing things like, it's really only there when you stop and think about it?
Right now, I have no pain. Right now, I truly don't have any pain. I think it just depends. It depends on what I'm doing. Sometimes, like if I'm laying down and if I get up, like I feel like I have to get up slowly, just because there's a little bit of throbbing. But today's the best day as far as pain. My pain is very minimal today.
Yeah. So your description is pretty accurate. So we give people, we ask them to take Tylenol the first 2 or 3 days around the clock. We give them 10 pain pills. You've taken a total of one so far, 2 halves. No one ever needs more than 10 pain pills. I mean, and if it wasn't for the neck, we wouldn't have given you any pain pills. If it's a nose, we don't give pain pills at all. We just give gabapentin for that, and that's perfect. So let's see, is the surgery done in the hospital or office? It's done in my office, but my office is not a normal office. So I have 2 accredited operating rooms in the office. And if you just came in that side of the building, you'd think you were in kind of a fancy surgery center. So it's done in my office, but my office is not a normal office. Let's see what else. So you got home, and then you're out grocery shopping later on, even though we provided, you still need random stuff. You've been out and about, so you haven't been laying in bed this whole time.
No, I have been sleeping a lot. Like I'll take naps, but when I'm awake, I want to do something. I don't want to, it's so depressing to just lay there. And like you said, like, don't just lay there and get depressed. Like if you can walk and if you're able to, just go out. And like, honestly, I'm not from Missouri. Nobody here knows who I am. They're not going to remember me walking around like this. It doesn't matter.
Absolutely. It's like I said, not even your phone can recognize you at this point. So like, why worry,
It's true. Nobody knows who I
But
am. I'll never figure.
yeah, I mean, why worry? Just get out there. And that's the best thing, about being in a different city for surgery is, who cares? And you're so like laid back about it. I don't think you'd care even if you're at home at this point. You'd be like, whatever. It's my face. It's my life.
Yeah, I probably, if I was back at home in New Jersey, I probably would walk around too.
Yeah. Well, anything else you want to tell these guys? I don't want to keep you. This has been really, really helpful. Anything else you'd like to tell them before I let you go and get on with your recovery a little bit?
Well, there's just one thing I want to say. So I have a couple of people just going into my DMs and they are asking questions of, they think because you're a little bit pricey, is it worth it? And the only thing that I have to say is like, so I have a friend that recently got surgery. She had a BBL, so it's a different category, but her experience was not good at all. I don't know how much you want me to talk about it, but it wasn't a good process. And
What?
then,
Describe it. Describe. I think it can be helpful. Go ahead and describe
yeah,
it.
so she called, she did a consult. So she was cleared to go for surgery. She went for surgery. She didn't sign consent until, like, they didn't get her to sign consent until she was already sedated. So she does not know what she signed. And, so that she doesn't even know exactly what they did. They did do the BBL. They did the 360 around the waist and they put it in her hips and her butt. But to not know exactly what you signed for is a little bit terrifying.
And when did she first meet her doctor? You were telling me this earlier. When did she first meet the doctor?
Afterwards, you mean post-op? It
No,
was,
I think you said. Did you tell me that the doctor wasn't even there for the consultation or something like that?
the doctor was not there. So my friend kept saying, I want to see the doctor before surgery. I want to ask him, I want to confirm what we're doing. She kept telling the nurse that. The doctor never came to see her. And if the doctor came, she was already sedated, that she doesn't remember what she signed or anything. Did she even sign? I don't know. So she went into surgery. She came out, and then she didn't have her follow-up until a week or two later. And when I look at the comparison, I had the consult with you. It was super friendly and like super inviting. Everybody treats you, I don't even know how to explain it, but so well. And then you're treated like a really good human, right? You know, you come in and they treat you how it should be, in my opinion, right? They make you feel comfortable. They don't make, I don't know, headache. I'm not just like carrying on here, but, and then you had the interview. I've already had my consult. Then I had a very extensive, it was an hour-long interview on the phone about what's going to happen, the pre, intra, and post-op. And then I came for surgery. Not only that, you continuously talk to people on your Instagram. And if anybody has any questions, you'll do that. I came for the surgery. I think I had like 3 different people ask me separately, what are you having? They made sure I knew exactly what I was having before even signing consent. We did more pictures in advance. They kept making sure if I was okay or anything like that. I mean, and then I had my surgery on Friday. I saw you first thing Saturday morning. Sunday, we did the video, which was today. I did the video. Tomorrow, I'm coming into your office. I have another appointment. I mean, on how many times? And the thing is, like, you get what you pay for. I have nutrition. Like, I'm well cared for. This is my face, you know? So I feel very comfortable with this entire process. And it's a very extensive process, but it's a very amazing process.
Well, thank you. So, yeah, it's almost like, restaurants or hotels or cars or, hiring a band to perform at your party. Like there's just different levels and there's something for everybody. And, all I try to do is be the absolute best we can and give the absolute best service we can. And we can only do that to a small number of people. I can't be that involved and I can't do, one procedure a day for 10 people a day. If I do one a day, I get one a day. That's how it goes. So anyway, I really appreciate you taking your time to share with everybody from so far. I suspect that they would be more than excited to do another one of these. Maybe when your splint comes off,
Yeah.
or maybe at some other point. It's totally up to you.
Oh, yeah.
Um,
That's
but
fine.
I'm excited for you. And even if we don't do another live, I'm sure I'll get some video of you when your splint comes off, or maybe once or twice here in the middle, just so they can see how your progress is.
Yeah. All right. Thank you.
You're welcome. Thank you so much. Say bye to Liz for me.
Okay.
All right. Bye. Thanks, everybody.
See you.